Hi, I'm Dr. Erik Handberg, and this is a Forensic Pathology Fellow case. Now, the cases here and the pictures are created with the assistance of ChatGPT, and that means any similarities to real life people or situations is purely coincidental. So this is case number one, the long drive. So I'm going to start by giving you a case summary, and this is the information that we would normally get from our death investigators. Death investigators are essentially what they sound like. They're people who go investigate the scene of the death, and they'll give us the situation that surrounds the body. They'll tell us what the body looked like. Think CSI, but rather than working for the police, they work for the medical examiner. So, what I know about this case is this is a 54-year-old man who was found deceased in the driver's seat of a car off a rural road. And according to the death investigator, there's no significant trauma to the body, and there's also no significant damage to the vehicle. The engine was found on and idling, and the decedent had what was called a nosebleed. Now, I put nosebleed in quotes because oftentimes, now this isn't usually what the death investigators, they can tell the difference, but family or police officers or other bystanders will often see what's called purge and interpret it as blood. And purge is when you have the sloughing of tissues from typically the airway and the esophagus. After someone dies, those tissues die, and the sort of accumulation of gas that happens after death pushes that slough tissue out, and it can give the appearance of blood, but it's not in fact blood. So that's why I put nosebleed in quotes. So there's a nosebleed and lividity on the face, chest, and posterior lower extremities. Lividity is, of course, that bluish purple discoloration that occurs because of gravity after death. We did find out that this decedent had complained of chest pain earlier that day, but had brushed it off as heartburn. So here's the scene. Now, often we'll get photographs of a scene. I would say almost always, assuming that we have medical legal death investigators that go to a scene, we will get photographs of the scene. And at this scene, the decedent had their seatbelt fastened, their seat was slightly reclined, and they were leaned forward with their head up against the steering wheel. They had a single small abrasion on the dorsum of the left hand, which just means the back of the left hand. And that's included because it is, in fact, trauma. But we said earlier there's no significant trauma. And we don't even know if that abrasion is something that happened earlier that day or if it is in relation to this quote unquote motor vehicle accident. So there doesn't appear to be any vehicular damage, and there's no signs of medical intervention. So there's no vehicular damage. You don't see shattered glass or dented hood or anything like that. And there's no medical intervention, meaning we don't see EKG stickers on the body, no cardiac defibrillator. It doesn't look like the cardiac compressions were done. He wasn't intubated, et cetera. Notably, there's groceries and coffee in the car. And the reason that matters is because it shows what the decedent had been up to immediately prior to their death. They had gone to purchase groceries, and there's groceries and coffee in the car, which shows me that since they haven't spoiled, I believe this happened relatively recently. And without the coffee spilling everywhere, it makes me think this wasn't a very high velocity impact. And that goes along with the idea that there was no damage on the car. Notably, there's also no skid marks, which to me indicates there was no attempt at braking before impacting the tree. And there's no airbag deployment, which again supports the idea there was no significant vehicular impact. So we get the past medical history, again, something obtained by our death investigators. This can be done by they can ask bystanders if they happen to know the person, if they're friends or family, but more often than not, it's by obtaining medical records from the decedent's primary care physicians and other physicians, or if we're very lucky, we may in our office have access to the medical records. So this decedent had a history of hypertension, which just means high blood pressure, and occasional back pain that they controlled with NSAIDs. They had a past surgical history of an appendectomy about 20 years ago. So that's when they take the appendix out, and a cholecystectomy 12 years ago, and that's when they take the gallbladder out. Social history, uh, they were a smoker. So they had 30-pack year smoking history. At the time of autopsy, what was found was a hemopericardium, and that means hemo is blood. So that's blood in the pericardium. The pericardium is the sac that surrounds the heart, and there was 300 milliliters of blood in that sac that surrounded the heart. There was an ascending aortic intimal tear. So the ascending aorta, the aorta is the largest blood vessel that leaves the heart. And the ascending aorta is the part that comes up and sort of goes up and out of the heart before it turns down to feed the rest of the body. And the intima is the innermost layer of that blood vessel itself. And there was a tear there. There was also a dissection through the arch with a rupture. So, aortic dissection is when blood can get through the intimal layer. So, normally the blood vessel functions like a tube or a pipe. And in this case, the blood was able to get through the pipe. And so it got in through the innermost layer of the wall, the intima, and actually digs into the media, which is the middle, big, thick muscular layer. And when that happens, you'll get what's called an aortic dissection. That's the definition of the dissection. And that can in itself be incompatible with life. It can cut off blood flow. There is another complication where it can continue to burrow through the wall of the aorta itself and get through the adventitial layer, which is the outermost layer of the wall. And once it gets out of that, it's effectively perforated the aorta, and you can bleed inside the body, get internal hemorrhage. And in this case, that bleeding occurred inside the pericardium. So there was also cardiomegaly, which means the heart was too big, was 580 grams. For most people, uh, typically I would say over 400 is too big for most men. Uh, there is some variability there. There was mild coronary atherosclerosis. So coronaries are, of course, the blood vessels that feed the heart itself. And there was pulmonary congestion. That's something that's very, very commonly seen after death. And there were no emboli nor any aspiration. Toxicology results, which typically come in a very good situation, you can get them relatively quickly within a few weeks, but oftentimes it can be 6 to 8 weeks or longer to get these results back. In this case, the decedent was negative for drugs of abuse, which is things like fentanyl, heroin, cocaine, methamphetamine, amphetamine, things like that. Was positive for ibuprofen at a therapeutic level. And we put out a therapeutic level because if it looked like the decedent had taken, say, 1,000 tablets of ibuprofen, it would give a different picture to what could have happened here. But in this case, it seemed like they had just taken a reasonable amount of ibuprofen and there was no alcohol detected. Right now would be a good time for you to pause the video, and I want you to think about what you believe the most likely cause of death to be. So on a death certificate, you're going to actually input the cause of death. Up here on line 1, you would put the death was due to this, and then secondarily, what caused that? So option A, which is due to option B, which is due to option C, or I should say line item A due to line item B and C. So what would you consider the cause of death? What would be the mechanism of death? Then how would you classify the manner of death? And as a reminder, for the purpose of these videos, most states, most jurisdictions, the options for manner of death are homicide, suicide, accident, natural, and undetermined. If you were going to consider this a natural death, how do you justify considering it a natural death despite this death occurring in a car and a car that hit a tree? And then for anyone who actually is a medical trainee, resident, or fellow, how would you go about explaining this situation to the decedent's family? So I'm Dr. Erik Handberg. I'm a forensic pathologist and medical examiner, and I'm going to give you my professional opinion on how I would answer these questions for this fictional case. So in this case, I would say the cause of death here, my wording would be complications of hypertensive atherosclerotic cardiovascular disease. And the reason for that is that this person ultimately died because they had an aortic dissection that perforated and led to blood around the heart. And the reason they had that aortic dissection is because of a long term chronic disease with hypertension. And based on the findings of atherosclerosis in the known history of smoking, I would say complications of hypertensive and atherosclerotic cardiovascular disease. And I would contribute smoking because that's a risk factor for these complications. It would be reasonable to on line A put aortic dissection, and then it inherently becomes due to hypertensive atherosclerotic cardiovascular disease or HASCVD. It would also be reasonable to put cardiac tamponade due to hemopericardium, due to perforated aortic dissection, due to HASCVD. But ultimately, it would also be fine to just say complications of HASCVD and leave it at that. Um, I should clarify tamponade. So we'll get into mechanism of death. So that's what I believe the cause of death to be. Mechanism of death, in this case, I believe it to be what happened was the cause with this complications of HASCVD led to an aortic dissection. That's that intimal tear. And then blood actually went out through the wall of the aorta and perforated into the media, leading to that dissection, and ultimately perforated through the adventitia, leading to hemorrhage. And in this case, the hemorrhage occurred inside the pericardium, and that caused that 300 milliliter hemopericardium. And when you get a rapid accumulation of fluid in the pericardium, it can cause a condition called tamponade. And tamponade is when you have something on the outside of the heart that compresses the heart and it prevents the heart from doing what it's supposed to do, which is to be able to expand, fill up with blood, and contract and push that blood out. That's what contributes to blood pressure. That's how you get oxygen throughout your body. And in this case, the heart, because it couldn't appropriately expand, this person would go into rapid onset heart failure and then ultimately not have any blood flow. And that's what the cause of death would be. And so ultimately, the cause of death, HASCVD, the mechanism of death would be tamponade, I believe. And the manner of death would be natural. And the way that I defend this being a natural death, despite the fact there's an apparent motor vehicle accident, is that we can clearly see there's a very low speed motor vehicle accident. We don't see any damage to the car, the airbag didn't deploy, and I don't see any evidence of blunt trauma to the body, with the exception of the very small scratch on the back of the hand, which I don't believe contributed to the death. In fact, I don't even know if it was related to the car accident or if he simply bumped his hand while getting groceries. So I believe that this person had actually died before the car accident happened, and probably that is the reason for the car accident. And that is basically how I would explain this to the family. I would say something like, well, if this is the father, I would say your father had a very long history of high blood pressure and atherosclerosis, and that's the buildup of cholesterol in the walls of the arteries. And that, in combination with smoking, causes a lot of damage to blood vessels. And in this case, the end result of that damage was a tear on the innermost lining of the aorta, which allowed blood to get out through and into the wall of the aorta and eventually perforate all the way through. And that caused a very quick hemorrhage, bleeding around the heart. And that blood compressed the heart and it made it impossible for the heart to do its job. And therefore, there was not enough oxygen and blood getting to the brain. And that's what caused death. And so I do believe that he died before the car accident. And I think that was the cause of the car accident. Now, the way we explain things to families, that's always going to be a stylistic thing. That is not like the way I just did it. That's not necessarily the only correct way to explain it. That's just my style of doing so. And I recommend that as a medical professional, you practice and learn your own style of explaining things. But I do encourage you to always try to explain things in a way that can be understood. So try to avoid using too many big words, or at least clarify when you do use medical words what they mean. So if you have other comments, if you have questions, if there are other cases you'd want to talk about, I can generate a fictional case and we can talk about those. And in the future, it may not always be me that's explaining our professional opinion and how we would go about the cases. So that is Forensic Pathology Fellow Case number 1.